most of the time interfere with your health. And when you look at cancer, it develops in the body's control mechanisms to that, especially when the old cells do not die and they grow out of control, forming mass called tumor. In a week or so, cancer patients would learn that this is getting serious, especially for most ladies who didn't take HPV. So human papilloma virus is a major issue for most ladies, and the vaccine is even worsened because we don't go for pap smear normally. The average person would experience some changes in the body, especially in terms of their hormones and in terms of the changes that are happening in the body. So now, normally, the vaccine is taken between 12 to 46 years. And for most ladies who are exposed, they go for this vaccine so that we can reduce the number of people who are having cervical cancer. Truth be told, the rate at which most people are having pap smear is low, because this is the screening and testing to check the health status of the cervix, so that you don't wait until you develop cancer. That's when you start running around. Now, why human papilloma virus? So when you go for pap smear, what happens? So for every lady, we usually advocate that you go for pap smear so that we check the cervical health to prevent lifestyle diseases that are coming, and especially the aspect of preventing stages of cervical cancer before it becomes more serious. Now, this is what's happening. It could lead to what some ladies experience human papilloma virus. It's a type of, it's the most common sexually transmitted infection. Many people develop the symptoms, and this come by sexual contact. So when this happens, it can include what? It can include genitals, surrounding skin. So the cure for the virus is not there. So most of the time we advocate that you go for the vaccine, the HPV vaccine, so that you can develop the right antigens to prevent the infections. So what causes the HPV in females? You get HPV vaginal, anal. Most of the time it's oral sex, and the virus is usually attacking most ladies, especially when they go to the swimming pool. Some skin to skin touching contribute to the HPV. And HPV is serious because now human papilloma virus is a sexually transmitted infection, and for most people it's harmless unless it grows to a level where it becomes infectious. So what causes HPV, which now leads to cervical cancer? Mostly people experience to transmit through skin-to-skin contact, and the direct sexual contact is a major issue, especially vaginal, anal, and oral. So the symptoms of this. So when you contact human papilloma virus, it can infect cells, vagina, and the vulva. If females have low risk to HPV, then now we can prevent things like warts. So some of the symptoms include bleeding after sex, unusual discharge, alarm in the vagina. Alarm in the vagina, pain while having sex. So this leads to malignant tumors in the lower part of the uterus, the womb, that can be prevented by going for pap smear, screening, so that the HPV vaccine is taken care of. There may be symptoms. In a few cases, you may experience irregular bleeding and all this. So what is the main cause of cervical cancer? Nearly all cervical cancers are caused by an infection, which certain high risk, like human papilloma virus, and this is a major issue for most ladies, especially for blood or light between the periods, menstrual, that may take longer and heavier than usual. Bleeding after intercourse after doing examination or medication. So for most friends, it also increases the vaginal discharges and causes more. So for most of us, notice that most people who develop cervical cancer will develop things like whites. And some of the definitions I want to use, like terms like tumor, as an abnormal mass of tissue that when the cells grow and subdivide, they could turn malignant. So benign tumor is when the cell grows and when the cells grows and subdivide nearby tissues. Malignant tumor grow and spread around to invade other nearby tissues and spread to other body parts. So if you look at issues like metastatic tumor, you could find it subdivides and grows into other lymph nodes. And cancer cells could enter other lymph nodes. Cancer cells could enter the blood. So the primary cancer can spread to other parts of the body. So cancer is uncontrolled growth, abnormal cells in the body that are subdividing and they are abnormal. So they are subdividing and forming more abnormal cells. And this is what is worrying so much, because now when you don't take a HIV vaccine and it grows to cancer, then the strains now become a major issue. So metastasis is the spread from one part of the body to another. When cancer cells metastasize, they form secondary tumors, and the cells subdivide and they form more of the tumor growth. So carcinogens are specific chemicals or physical reactions that are agents for speeding up that cancer development. So the major issue here is the human papilloma virus. So if you didn't, as a lady, if you didn't take the vaccine, then we would advocate you do, so that we can reduce the number of ladies that we are losing about 40% of the ladies to cervical cancer, and we can prevent. According to statistics, the different types of cancer that affect women include breast cancer, which is about 22.9%, colorectal cancer, which is 9.4% in terms of claiming lives, cervical cancer, which is at 8.8%, lung cancer, which is at 8.5%, stomach ulcers, which is at 5.8% also. So the numbers of cancer are on the increase, because now if you look at breast cancer, when the cells subdivide in an uncontrolled way, creating mass of tissues in the tumor. So most of the ladies, we advocate that you check if there's a lump in the breast, if you're experiencing changes in the skin of the breast. Colorectal cancer, you can also be checked in the hostels, so that you can reduce the number of people that you're losing to colon cancer. And we have solutions for this, so that you can have very good health and enjoy your life until you're able to live to 100 if possible. So what is cancer? Cancer is when the cells subdivide, they multiply when the body needs them. Normally, when it reaches a point, they should now stop subdividing. But when they continue multiplying in a disorderly way, then they form mass, they form growth, they form tumors. So these tumors can be benign or they can be malignant. Cancer as a malignant tumor potentially can be unlimited in growth. So when it metastasizes, then that becomes a major worry for most of us. So why cervical cancer? The difference between a normal cell and a cancerous cell is that when cells grow, the absence of signals for them to stop growth is a major worry in terms of the signal sent. When the cells ignore signals to stop multiplying and subdividing, that's the process now when now the cells are programmed to die. It's called apoptosis. When now the cells invade other nearby areas, they spread to other parts of the body, the normal cells stop growing when they encounter other cells. but now the cancerous cells keeps on multiplying. Now, when you look at tumors, when they affect the blood vessels and oxygen, nutrients, and the tumors, and they hide behind the immune system, making it impossible for the normal cells to identify the abnormal cells. This tricks the immune system to help the cancer cells to stay alive and grow. For instance, some cancer cells convince immune system to protect the tumor instead of attacking it. So these are the major issues. So if you look at when now they over-rely on the nutrients on the normal cells and they predate on them, then now that's when lead to different stages of cancer. So carcinoma is a type of cancer that starts as a cell that makes up for the skin tissue lining organs such as the liver, the kidney, and all this. So when now you come to hyperplasia is when now you find enlargement of an organ or a tissue caused by increase of organic tissue that when the cell starts proliferation and multiplying, it could grossly enlarge to affect the organs and the tissue around it. So that's now when they are calling it a benign tumor. A term used to describe abnormal cells within a tissue or an organ, which now affect the functionality of this. So in stage 0, there's a group of abnormal cells that are growing. And this is now when they alter the epithelial cell. Hyperplasia, when the cells divides and rapidly to form around the normal cells. And then they change form. Then now it becomes an in situ cancer where it stays in one place. But malignant tumor can invade other tissues and enter blood streams, enter lymph nodes. And when it metastasizes, that's what now we're calling a malignant tumor. So stage 1, the cancer can be relatively small and contained within an organ. And this is curable. Stage 2, you find the cancer cell getting larger and then spreading to other surrounding tissue. Stage 3 is when cancer becomes large and spread through the lymph nodes. Stage 4 is when cancer now spread through the blood and gets to the lymph nodes and gets to other parts of the body. So now those are the stages that cancer passes through. So you find a normal one, then it goes to hyperplasia, then it goes to dysplasia, then it goes to full-blown cancer. So if you look at this other diagram, explains now when carcinoma is in situ and how the cancer now starts growing. And this also is a major issue for most people because carcinogens are substances that are potentially causing cancer, and carcinogens are chronic toxins. They cause or damage repeatedly when now they take longer in the body and when the body gets exposure to this. So some of the causes of cancer could be carcinogens, could be able to self-destruct, and sometimes it would be radiation, UV rays. And if you look at some of the treatments of cancer, it's high doses of radiation to kill cancer cells and shrink tumors. At low doses, radiation is used in X-rays, UV rays, and all this. Especially at some stage, you find cancer, you're going through radiotherapy, which may be used early stages of cancer or after it starts to spread, and it can be used to to cure cancer. This is curative radiotherapy and the treatment more effective. For example, if it combined with chemotherapy used in surgeries and all that. So what is the success rate of radiotherapy? When patients are treated with modern external beam, the percentage is 93.3. But over the next 5 years, you're finding it could improve to 96.9%. So there are those factors that play a major role, like the chemicals you're using, whether you're a smoker, if you're using a lot of pesticides and exposed to a lot of pollution, if you're predisposed to hereditary issues, if you other infections like hepatitis, HIV, AIDS, papilloma virus, as we are discussing now. And now the other leading issue is your dietary factors that comes into play. So I know there are over 200 types of cancer, which I may not have the need to go through now. But some of the symptoms associated with the cancer, be it local ones, unusual lump that you can detect in a place, swellings, hemorrhages, pain, ulcers, jaundice. Other symptoms of metastasis could include enlarged lymph nodes, coughs, some enlarged liver, bone pains, fractures, neurological symptoms. Other symptomatic issues could be poor appetite, unintentional weight loss, fatigue, nitrates, and other vomiting. So treatments around cancer could be radiotherapy, chemotherapy. Some would go for surgery. So chemotherapy is a drug treatment used for when now one uses a lot of chemicals to kill fast-growing cells in your body. Chemotherapy is the most often used to treat cancer, especially now, if it's multiplying. Outcome actually depends with the physician's skills. It is a risk. It's a risk that you take to remove the tumor near the brain, large vessels, and include complications that most people would not like to discuss in this place. So inevitable damage in normal tissue could be suppressing the tissues that are there. And my main objective is to help you achieve the best out of life and live your life to the best of your ability. So all these medical tests are within reach, and my role is to also create awareness about the side effects. So when you come on board, what we're doing is that there are side effects like loss of appetite, diarrhea, infertility, and sore mouth. So we also give solutions. So if we give you solutions that are able to give you results in terms of addressing other issues that come because of this, could be endometriosis, which is a disorder when the tissues around are creating a lot of growth and could metastasize by spreading to other parts of the body. And our role is to give you solutions that can address problems like fibroids, address growth that should not be in your body, and this is to prevent pelvic pains, prevent frequency in urinating, difficulty in the bladder, constipation, leg pains associated with this. So the solutions are here with us. So we give you dietary supplements that can address the imbalances in the body to improve health during treatment, to prevent bleeding between your periods, to address bleeding during intercourse, to prevent challenges of cervical cancer and management of the same. So these are antioxidants. Antioxidants are food particles that help prevent the lifestyle diseases. The second product that I would like to talk about is Pure Unbroken. I've given this to a number of friends who had reached stage 4 of cancer. And this is brilliant ingredient for preventing growth of cancer cells, preventing the discomfort. Even if it's the breast cancer, it will help you with the lumps and the nipple. Any discharges that are not supposed to be there will be taken care of. Our role is to promote quick recovery from all infections, promoting quick during the treatment of major surgery, whether you're going through a lot of chemo. This will help your liver to cope through the strenuous mechanisms that the doctors use. And we also give you anti-inflammatory products, like Pure Unbroken is very good for preventing metastasis, that's the spread of cancer. Pure Unbroken is amazing as a strong antiviral, antibacterial, antiviral issue, and will address any free radicals in the body and prevent fatigue during your medication. So this works very well for promoting the tone of your kidney, the liver, as an anti-inflammatory, making sure Pure Unbroken comes into play to address oxidative effects of the medication that you're going through, and also it also had hepatoprotective effect in terms of preventing liver injury and ensuring that if someone has been using alcohol, the liver will not degenerate. So gynoderma is a special source of protection and treatment for most people who are going through cancer immunotherapy, and also amazing for providing you with the defense mechanism that you're looking for. The second product that I would like to introduce is 𝘾𝙀𝙀𝙀𝙀. 𝘾𝙀𝙀 is amazing for preventing and killing cancer growth, and 𝘾𝙀𝙀𝙀 is amazing for vibrant life and giving you the longevity you're looking for. It improves the white blood cells and the lymphocytes that address the chemotherapy that most people go through, and it deters abnormal cell growth in the body. This stimulates the L follicle and also helps you to cope with the heavy treatment that you're going through. 𝘾𝙀𝙀𝙀 is working for most ladies for addressing gynecological problems, be it fibroids, be it cysts, be it cramping, hormonal imbalance, menopausal syndromes that come, mood swings. I know most ladies who experience a lot of vaginal dryness. So 𝘾𝙀𝙀𝙀 promotes lubrication and mucus secretions. So it's very good for female libido, and it gives you very serious orgasms. So if you're experiencing dysmenorrhea, this is a scenario where you're having painful, difficult menstruation. This prevents that light or heavy bleeding that most ladies experience from time to time. And also, this is a very good product for addressing hot flashes and night sweats. It's a turkey tail mushroom and useful for dispelling sweat, removing toxins, strengthening your physique. So every other time I give 𝘾𝙀𝙀𝙀𝙀 to a lady, she tells me that I gave her the best product ever for balancing her hormones and also for giving her the dignity she was looking for in terms of addressing her body needs. Now, this is amazing food for addressing the body needs, and also addresses the side effects of chemotherapy. You don't have to wait to get to a point where you need medication to start. So we give you building blocks for food. If you look at Feminergy, a study led by author Dr. Xiangling Shi, a professor at Graduate Center for Toxicology in the University of Kentucky, noted that by giving Feminergy and grapeseed extract to the patient, they found that the cells, the leukemia cells and other cancerous cells were able to commit suicide. I repeat, by giving Feminergy to as many clients who are going through a lot of chemotherapy and a lot of radiation, they found that the cancer cells were able to commit suicide. So this is a product that I usually advocate for treatment and for management in terms of the skin, for bringing the right skin tone. I know of ladies who had lost hair, and by giving them Feminergy, this has helped so many people who are going through difficult medication to cope, and also amazing for preventing things like psoriasis, acne, eczema, and all this. So we give amazing food for addressing your body needs. The other product is douching. When was the last time you douched? So as a lady, you don't want discharges, you don't want to have a lot of smell around your private part. So this is to keep the vaginal place clean. So when you are addressing cervical cancer, this comes in handy for addressing other needs that you may have as a person in terms of your hygiene and aesthetic reasons. Femicare for preventing and for treating different discharges, and is amazing for douching and giving you that gyno product that will give you results. So we also give 𝑦𝑡ℎ-EVER, which is as a resveratrol and amazing for addressing carcinogens, keeping the body defended, keeping the body protected, addressing chemo resistance, and also for giving your body that fighting power that it requires. Secondly, I also give NMN Duo, works wonders in 24 hours. If you're going through a period of a lot of strain, this is the product that I give, and works better when we address your health so that you can be cancer-free. And I thank you. So I'll stop there and unmute everybody so that we can stop the share. And I would be more than happy to unmute so that we can help as many as our friends to live a very good life without medication. Maybe I can ask you to unmute, Angela, if you have a question for me. I'm sending you an unmute, right? Do you have a question for me? Mercy?
No.
Yes. What did you like best about today?
Everything was perfect?
Yes, please.
Yeah.